Hello, everyone, and thank you for tuning in to our Facebook Live here at Ocean Baton Rouge. Today, we're going to be talking about Mohs surgery and skin cancer with Dr. Kelly Hall and Dr. Nicholas Frank. During the course of the live, we'll be answering any audience questions, so make sure you leave questions in the comments, and we'll try to answer as many as we can. So, first, we're going to start with some introductions. We're going to have Dr. Hall and Dr. Frank introduce themselves. Dr. Frank, would you like to start?
Sure. Thanks for having us. This is pretty exciting. So my name is Nick Frank. I'm here working in Oshner Baton Rouge at the new Mohs Surgery Center, which is part of the Cancer Center at the O'Neill Complex. I'm originally from New Orleans, did medical school at LSU New Orleans, as well as an internship there. Then went on to residency at Vanderbilt and did a fellowship for a year in St. Louis and made my way back closer to home to start my practice.
All right. And Dr. Hall?
So I'm Kelly Hall, and I've been practicing in the Baton Rouge area for 6 years. I'm originally from Mississippi and went to undergraduate in St. Louis and then medical school at Baylor in Houston. And I did my residency training in general dermatology at Tulane in New Orleans. So that brought me closer to Baton Rouge. And so I've been practicing Baton Rouge now for 6 years, seeing a wide variety of dermatology from more rheumatology cases to skin cancers to simple acne and warts and things like that. So I really enjoy it. And we're so happy to have Dr. Frank now.
All right. So today we're going to be talking about skin cancer and Mohs surgery. So can we first get a simple definition of what skin cancer is? Either one of y'all can answer.
Go ahead, Dr. Hall.
Okay, so skin cancer, I guess that term is a layman's term, but it encompasses a wide variety of different conditions that we see in the skin. So I guess technically cancer is, I guess we all know what cancer is. So skin cancer is something that's very common. It's probably one of the most common types of cancer there are, so common that it's not followed typically on cancer registries. There's three types that are out there. There's basal cell carcinoma, which is the most common, then squamous cell carcinoma, and the least common of the more common types is what we call melanoma. And that's the one that we worry about the most because it could potentially spread or what we call medically metastasize. And skin cancer affects, up to half of people. So once again, it's extremely common. So it's something that we take very serious and as far as diagnosis and treatment of it and prevention.
Okay. So is skin cancer life-threatening? Can it be?
It can be, and once again, there's the broad spectrum of skin cancer that's kind of delineated by the cell type it originates from. Luckily, the most common forms of skin cancer, the basal cell carcinomas and the squamous cell carcinomas, only rarely metastasize. If left untreated, it's always possible. When you get to things like melanoma and some other more rare types of skin cancer that biologically act a little more aggressive, they can be life-threatening. I think the important takeaway is with all skin cancers, if we catch them early or, like Dr. Hall said, we focus on that prevention part, we can really make a difference and change the outcome so that they're not life-threatening.
Okay. So Dr. Frank, can you tell us a bit more about the new Mohs Surgery Center at Oshner Cancer Center?
Yeah, this has kind of been 2 years in the making now. Dr. Hall knows we've been on this road for a while, and now we have this great, beautiful space. But while I was in my fellowship, I kind of approached the Oshner system here, and I was looking to get closer to home and felt like Baton Rouge had a need for more access to Mohs surgery. And I was blessed that the Oshner team kind of took it and ran with it. And we found a spot in the cancer center that wasn't being used but needed some updates. And they've invested over $2 million in renovating this space to kind of being state of the art and spacious. And it's really a pleasure getting started here, being able to work in such a nice space that's comfortable both for me and the staff as well as the patients. So it's been a really great project to see come to fruition.
Can you tell us a little more about what Mohs surgery is?
Yeah, absolutely. It's a specialized procedure that was developed for the most common skin cancers, uh, namely basal cells and squamous cells, especially when they're on the head and neck. And what it entails is you come to an outpatient setting. So we only use local anesthesia, numbing medicine. We don't do any sedation or general anesthesia. So in that outpatient setting, I remove the skin cancer that I can visually see is still present. And then while the patient waits, I check that under the microscope and I look for any of the cancer cells extending to the edges. I have the tissue mapped out so I know exactly where to go back if needed to remove cancer that is extending to the edges. And we kind of repeat that process. So each time we take more tissue, we refer to it as a stage. And we repeat those stages until we ensure that the margins are completely clear. I evaluate the entire margin, both peripherally and deep. And once we have the skin cancer out and confirm that it's out under the microscope, we turn our attention to how to repair the skin that's missing. And that usually involves suturing, or sometimes it's best to leave it in the heel. But we kind of get it all done in one day. So we remove the skin cancer, confirm that it's out, and repair the site all in the same day. And then the patient gets to go home as an outpatient and return to normal activity, more or less.
Okay. Dr. Hall or Dr. Frank, can you explain more about how you two would work together on behalf of a patient? Is it referral based? Like, would a patient start with Dr. Hall and then be referred to you, Dr. Frank? How would that work?
So typically, the general dermatologist would see the patient, establish a rapport, and hopefully we don't find skin cancers. But in the case that we do find skin cancers, we sort of have an algorithm as far as which patients we refer to Mohs surgery. Typically, it depends on the size of the skin cancer as well as the location. Now, Mohs surgery is very beneficial in that it typically leads to a better cosmetic result for the patient. So once again, we're extremely excited to now offer this and have our patients have access, and the patients in the community in Baton Rouge and the surrounding areas now have access to a Mohs surgeon at Ochsner. So basically, the patient would be seen in the office, and we would do a skin cancer screening. And to find a skin cancer, then we would discuss that with the patient and refer to Mohs. Once again, depending on the size of the lesion, as well as particularly for lesions on the head and neck, especially, and for larger lesions on the body. So that's where we would coordinate with Dr. Frank's staff to go ahead and get the patient referred for Mohs surgery.
How long does Mohs surgery typically take? How long would a patient expect to be there from start to
Yeah,
finish?
I get that question a lot. The short answer is we never quite know until we get into the case and the skin cancer is completely removed. Um, and that's really the interesting part of the technique, is that I'm able to remove the skin cancer in as small amount of skin as possible, and still ensure that it's out. But so potentially patients could be here all day. I will say that that's much more rare. Just by the numbers, usually most common skin cancers, if they aren't too large, go one or two stages. 90% of patients who come in were done in one or two stages, and they're out the door for lunchtime. That being said, I can't ever make that guarantee. The patient has to be prepared to be with us all day, which is why we try to create a very comfortable setting, and they made this great some waiting space that I'm sitting in here right now, because sometimes they can be with us for quite a while. But typically, it's going to be on the order of a few hours. One important note is that each time I take a stage, it takes about an hour to an hour and a half, give or take, for us to process the tissue and for me to evaluate it microscopically. So kind of at minimum, a couple hours, and at most, you could be here all day. And sometimes we do run into that. But commonly, you're if you come in the morning, you're at home for lunch.
Can you tell us a little bit more about the waiting space?
Yeah, I would love to show it to you. I'll absolutely mess the camera up if I do that, but you can kind of see part of it behind me here. And on either side of me, which you can't see, we have these nice lounge chairs, and we have a TV set up and a very comfortable space here. We also have a small kitchenette with refreshments and a coffee maker and some snacks and things to give people through the day. So it's really one of the highlights, I think, of the space. Oftentimes, the anxiety provoking part, the most difficult part of the day for patients, is having to sit and wait and think about, okay, is he going to have to take some more? How much is he going to end up having to take? And I think this is a good environment to kind of settle those fears. We're going to take good care of you, and you can be comfortable while we do it.
Okay. So we have a
So,
question from the audience. Mhm. Go ahead.
Oh no, I was just about to add in. So the beauty of Mohs surgery is that they only take what they need, whereas in general dermatology, we take a standard margin. So it's part of it is that you do wait a little bit longer, but he's only taking what he needs each time. So you end up with a smaller scar, and so it's a better cosmetic result. We often on the referral end will tell patients to bring a book to read, if you knit or crochet, bring something to do to kind of keep you occupied so that your mind's not worrying about those fears and what's going to happen next, or if he's going to have to take another stage, that kind of thing.
That's a great point,
Okay.
Dr. Hall.
Okay. Thank you for sharing that, Dr. Hall. So we have a question from the audience. Angie wants to know, is there an easy way to tell if I should be worried about a mole that seems to be getting bigger?
Okay. So from a general dermatologist perspective, we share the A, B, C, D, E, F of melanoma. So that's something that we sort of educate our patients about when we do our skin cancer screenings. So I think one of the most important things is, well, there's a couple of factors at play. One is the patient's underlying risk. So if there is a family history of melanoma, that's definitely more concerning, or if they're more fair skinned, if there is a history of tanning bed use, all those things we sort of take into consideration when we're advising patients about their melanoma skin cancer risk. I think the most important thing as far as adults and moles is monitoring the mole and seeing if it changes with time. I typically would not like for your moles to change much once you get past the age of 30. So it depends on Angie's age. It depends on her family history. It depends on, her if she's fair skin or her skin tone type. So all those things come into play. But as far as the A, B, C, D, E, F of melanoma, A is for asymmetry. So if you cut it down the middle, one half should look like the other half or be a mirror image. If all of a sudden there's a little part that's kind of jutting out, it's no longer symmetrical, that's more concerning. B is for borders. So jagged borders are more concerning. It should be a nice and smooth border, nice and smooth edges. C is for color. So the mole should be a nice even tone. So a light spot next to a dark spot, next to a black spot, that's all more concerning. D is for diameter. We typically say anything larger than a pencil head eraser. Now, the exception to that is if you've had a mole that's been there since you were a baby, what we call a congenital nevus. Those can typically be larger than a pencil head eraser. And then we throw in E for evolving. I think that's probably the most important one, once again, for adults, especially once you get past the age of 30. Your mole really should not be changing much. And then we throw in F for family history. So people who have a family history of someone with melanoma, and by family history, we mean a first degree relative. So that's mom, dad, brother, sister, and your children. So anyone that's a first degree relative that has a history of melanoma, and at least once a year you should be having a full body skin check, basically to look for abnormal moles or melanomas. The beauty of finding an abnormal mole is that we may actually prevent it from developing into a melanoma. So that's F for family history, and then we also throw in funny looking. So I've had several patients who really didn't have any risk factors, but came in just because the mole looked funny, and we would biopsy it, and it come back abnormal. So we always throw an F for funny looking as well.
And
Okay.
I would
Okay. Thank you.
tell Angie, I like to throw in the H, which is if you're thinking about it, you go see Dr. Hall and let her expert eyes take care of you.
All right. Sounds good.
Thank you. Thank you both. So before we move into some general skin cancer screening questions, I did want to ask, can some types of skin cancer be treated non-surgically? And when is surgery necessary?
Yeah, absolutely. Really, management of skin cancer, we may have certain recommendations um, given things like what Dr. Hall mentioned earlier, the location and the size and things that play in, which may, uh, you know, make one method of treatment versus another more appropriate. Mohs surgery is reserved for certain skin cancers on the head and neck, where we need to conserve as much tissue as possible, or larger or more aggressive skin cancers on other areas of the body. But other treatment options, and we really consider these for all, are traditional excision. So in your general dermatologist office, just taking out a rim of normal skin around it and sending that off to the pathologist to be evaluated after you're stitched up. There are also certain treatment modalities that involve radiation. Um, the last kind of uh, broad treatment modality we can use in certain skin cancers, if they're very superficial and in the outside layer of skin, there's actually some topical chemotherapy creams and different topical agents that can treat some of those. But it's important to not pigeonhole yourself into one treatment, but really have that discussion with your dermatologist about what treatment option is best for you, given everything else you have going on, um, and and the nature of the skin cancer you've been diagnosed with.
Okay, thank you for that. So we're going to move into some general skin cancer screening questions. The first question is there a certain demographic of people that should always get skin cancer screenings? And Dr. Hart, you kind of already touched on this a little bit when you were talking about family history and stuff, but could you explain a little more?
Yeah. So I think family history is one of the most important ones because our current guidelines that are set out by the American Academy of Dermatology discuss that if a patient has a first degree relative with melanoma history, then they should have an annual skin cancer check. Beyond that, there are certain things that can also increase your risk, particularly for melanoma, as well as for other skin cancers. And Dr. Frank can chime in on this as well. But being fair skinned, a history of dysplastic moles or moles that were atypical, those patients typically have to be screened more frequently. Any history of tanning bed use, there have been some studies that show that people who use tanning beds, particularly before the age of 25, even if it's just one time, may have a greater risk for melanoma. And that may just relate to having other sort of sun-seeking behaviors. Um, and Dr. Frank, do you have any others to add as far as, and transplant patients is also very important because they are under immunosuppression. So typically it's recommended that they have a yearly skin check done by a general dermatologist and beyond. And also from like an and other skin cancer also recommended. Transplant team.
Yeah, absolutely. I second everything Dr. Hall said. really any form of immunosuppression. Certain medications are more notorious for increasing your risk for skin cancer than others, but even if you have a medical condition that suppresses your immune system, we know that limits the immune system in your skin to be able to detect the abnormal precursor cells and make you more prone to having skin cancers. One big thing is if you have had a skin cancer before, you are probably at the highest risk for getting another one. We just know that that's how it typically plays out. I give this analogy to my patients a lot. If you think of all your skin like the garden, and if one area of the garden had enough sunlight to sprout a weed, probably there's another area of the garden that had enough sunlight to sprout a weed. And I use that because almost always skin cancers are triggered by UV radiation of one form or the other. But so I would add that family history and is another big factor. Also, if you are fair skinned and you don't tolerate the sun very well, you should be a little more careful and come see us to get monitored.
Okay. So, are there any steps that the average person should take to help prevent getting skin cancer? Maybe wearing sunscreen or whatever the case may be.
So yeah, so there's a couple of things that go in. So basically, trying to decrease sun exposure as much as possible. So when you are outdoors, sort of being smart about being in the sun. So we typically say try not to go outside or out spend an extended amount of time outdoors when the sun is at its brightest. So usually that's between 10 a.m. and about 4 p.m. And so you don't want to be outside, or if you are outdoors or you have to be outdoors, try to seek shade while you're out there. Wear your sunscreen. You want to wear something that is broad spectrum, at least an SPF of 30. You want to reapply. So if you're doing an activity where you're sweating quite a bit, you want to get the sports sunscreen or one that says it's waterproof. And those come in two different varieties, so like a 40-minute or 80-minute waterproof. So you want to reapply every 40 minutes or every 80 minutes. And believe it or not, every time that you towel dry your face, you should reapply because that removes, or towel dry your body, that removes most of your sunscreen. Like I said, if you're sweating or swimming every 40 minutes to every 80 minutes, and then each time you towel dry, you should reapply your sunscreen. Beyond that, we typically say if you're not sweating much, every 2 hours you should reapply your sunscreen. So those are some things as far as like sunscreen wise, as well as sort of avoiding the sun when it's at its brightest, that can help prevent skin cancer.
Mhm. So, I have a question. Would this also avoiding the sun? Would that also apply to like being near windows or if you use a sun lamp? Like I know some people use sun lamps for seasonal depression and stuff. Would that count? Or
So I'm not as familiar with sun lamps as far as the wavelength of light. I think it would probably depend on the wavelength. There are certain wavelengths that are more likely to cause damage to and trigger the potential for sun damage and skin cancers down the road. So I think it would just depend on the wavelength of light. Dr. Frank, can you add anything there?
Yeah, I'm not familiar with typical sun lamps. As far as standing by windows, I think that's a great point. Um, for example, most car windows if they're untinted, do transmit UVA light, and even some fluorescent light bulbs and ones used in big commercial buildings, they transmit some UV light. So even when you are trying to avoid direct sun exposure, you are picking up some ultraviolet radiation. And UVA, we know, contributes to things like photo aging and collagen degeneration and things like that. So it's important to keep in mind. If you're really prone or you have some of those high risk factors that Dr. Hall talked about, I'd recommend making a daily sunscreen kind of part of your routine, and they have developed um, really nice products, moisturizers and things that have broad spectrum SPF 30 sunscreen built in, that you can apply comfortably for daily use. And for high risk patients, I do typically recommend that for them.
Okay, thank you for that. So let's talk a bit about skin cancer screenings. What should patients expect when they go in for a screening?
So they'll meet medical assistant or the dermatology nurse first, and they'll take a brief history of the patient. So if they have a family history of skin cancer, if they've ever had a skin cancer before, if they've had previous biopsies or abnormal moles before. When I meet with the patient, I delve a little bit further. I ask them if they have a history of any tanning bed use. Um, and so all those things just kind of help us gauge their risk, and also help establish how frequent we should be following up with them to do skin cancer screenings. Now, typically, especially if we're doing more of a melanoma skin check, I will have the patient undress from head to toe. Some dermatologists will have you actually take off your underwear so you're completely in your birthday suit. I tend to have patients leave their undergarments on, but they take off all their clothing, and then we'll do a skin check. So basically, that is from head to toe. So that is looking through their scalp, that is examining their face, their body, looking in between the toes and underneath the toes, because in Asians as well as uh, people of African origin, the most common skin cancer that we find on them are, as far as melanoma, is on the palms and the soles. So we kind of look at patients everywhere from head to toe. And it's a little bit different than if you say we're going to a health, like a general health screening. Typically, during those, they may just look at your arms and look at whatever's exposed, but it's much more involved when you actually come into the dermatologist's office.
Wow. Okay. Um, so, so can skin cancer appear suddenly and spread quickly?
Yeah.
It's in broad terms, it's possible. I would say more commonly, it appears slowly over time and gradually grows and things like that. So Dr. Hall kind of laid out some specifics about the three most common skin cancers. The basal cell carcinomas and the squamous cell carcinomas, they typically have a more slowly evolving course, where it would be years before one would grow enough to spread potentially, with some exceptions. Melanomas, on the other hand, they can uh, present suddenly and spread quickly. Um, I have seen a number of patients, even young patients, who did have some risk factors, but had a pretty accelerated course with a new melanoma arising um, and evolving quite quickly.
Okay. Dr. Hall, is there anything you would like to add to that? Or
Yeah, just to piggyback on what Dr. Frank was saying, so we tend to discuss the three most common types of skin cancer. However, the skin is your largest organ. A lot of people overlook it and not think of it as being that important, but there's a lot, because it is so complex. There's a lot that can go wrong in the skin. So from our perspective, as the general dermatologist, we can see things from lymphomas and leukemias in the skin. We can see other cancers that are not primary in the skin, but they can metastasize to the skin. So we've seen, breast cancer in the skin. You can see prostate cancer in the skin, unfortunately. There's another condition called Merkel cell carcinoma that can also present as a tumor in the skin, and it has a very high mortality rate. So not to scare anyone, the beauty is that the most common types, basal cell, the squamous cell, they make up the overwhelming majority of skin cancers that we see in the skin. So not to make people fret, but basically if something pops up that looks abnormal that you're concerned about, it's best to come in and get it checked out.
okay. So, are there
And
any
I really would
misconceptions?
stress if we catch things early, the prognosis is greatly improved when it comes to skin cancer. And that's I'm willing to say that as a blanket statement um, for all skin cancers.
Okay. So, are there any misconceptions about skin cancer screenings, prevention, anything like that that you would like to address or clear up?
I think that's a great question. I would say, I think one thing is that, I think it just depends because, you know, I think you should expect for them to be thorough and kind of look you all over. And I think you should expect for a dermatologist to look you all over. So I think being prepared for that, especially if you're coming in for a mole check, we really have to look everywhere. So I've had some patients say, well, I don't have my toenails painted, or this isn't done, or that's not done. We don't care about any of that. We just care about your health. So we want you to just come in as you are, and let us do the screening, and make sure that we are taking the best possible care of you as possible and being thorough. So I think that's one of the misconceptions is that that patients will feel self-conscious about the exam, but we're very extremely professional. And this is what we do. We look at the skin, so we have to kind of look at you all over. I would say another thing that I hear patients sort of mention, or maybe a misconception, or just maybe not an understanding of that there are. A lot of male patients will complain about sunscreens and say, "Oh, well, that feels too greasy, or it doesn't feel good enough." There are so many elegant sunscreens out there that are available now that are very lightweight, that dry quickly. Um, and that won't leave a residue, or or you won't even be able to perceive there on your skin. So I think that's another great misconception that may prevent people from using sunscreen daily, even those patients who may be at a greater risk or at a higher risk.
I have
Okay.
uh, two comments that I thought of there. Um, Number one, they really have come a long way in making comfortable sun protective clothing, hats, breathable long sleeve shirts with built in um, uh, UV protection. And I utilize that personally even more so sometimes than sunscreen. Don't forget about that part of it. You don't always have to be lathered up in sunscreen. It should be a part of your sun protection regimen, but um, there are other options, and sometimes you just need to seek those out. One misconception I hear probably most frequently: "Oh, I'm not really worried about skin cancer because I tan so well." Uh, and unfortunately, there's no such thing as a safe tan. That just means you've picked up enough UV light to make your cells react to it, and that's kind of the very thing that can trigger skin cancer. So just because you're olive complected or you tan more easily, while that does give you, uh, some less risk, you still are reacting to the sun when you tan, and it could pose a threat for the development of skin cancers.
Okay.
Right.
So we
Oh, just to add in, so being of a darker complexion or darker skin type only gives you about an SPF of 13, and we recommend SPF of 30. So that's just to kind of put it in perspective.
definitely, yes, I've heard that before a lot too growing up, that, darker skinned people can't get skin cancer or can't don't need sunscreen, which is not true. I wear my sunscreen every day. So we have another
It helps with
question.
aging too. It helps with aging as well.
Thank you. So Angie has a question, another question. She wants to know, what is the best sunscreen?
Mm. So that's a very broad question. I think it depends on what your needs are as well. I think as far as if you're just looking for a good sunscreen that has a built-in moisturizer that is pretty lightweight and easy to find, there's one called CeraVe AM that I recommend quite a bit. A lot of dermatologists, we carry the Elta products that are also very lightweight, and they have micronized zinc, which has a more elegant feel, and it also provides provides broad spectrum coverage. I think that if you are spending more time outdoors, or once again, if you are sweating or swimming, then I think your needs are a little bit different, and so you may need a product that has more sort of like a waterproof sunscreen, that kind of thing. So I think it just depends on your needs. But I think for everyday use, I would say either the Elta product line or CeraVe. But there's a wide range and variety of products out there. So I think the most important thing is that you use it. So I really think it doesn't matter which brand, but using it and using it consistently, or like Dr. Frank was saying, investing in the UPF clothing, that kind of thing. I always tell patients it doesn't work if you leave it in the bottle. So it really doesn't matter the brand or how much you spend on it. You could get the cheapest sunscreen or the most expensive, but the most important thing is just to use it regularly.
Mm-hmm. Okay, is there anything else y'all would like to add before we wrap up?
Just that we are so excited. So we actually have, let's see, so we have three no, we actually have four general dermatologists, and we also have one dermatology physician's assistant, and now we have Dr. Frank. So we are just so ecstatic, and we're so happy that his surgical center is now up and running. Ochsner has invested a lot in the surgical center as well as into Dr. Frank to be able to offer this new resource and this new way of treating patients to our patients and to patients in the surrounding area. So, we're happy to have Dr. Frank and happy to be able to provide this resource now for patients who are not only just Ochsner patients, but patients who are in the community who see other general dermatologists as well.
Yeah, right in line with that. I think since I've started here, it's really become apparent that the Ochsner dermatology department is thriving, and it's really been under the direction a lot of Dr. Hall. I think she's influenced us a lot, and we have a great team of dermatologists who are excellent. I think patients love to see them. I personally send my family members to them. I think you'll have a great experience. And I know most people don't want to have to come see me in my new surgery center, but if you need me, we're more than happy to take good care of you.
All right. Well, thank you too for joining us today and letting us use some of your time to talk. And thank you to the audience for tuning in today for our Facebook Live. You can visit ochsner.org/cancer screenings to learn more about skin cancer screenings and other cancer screenings offered at Ochsner Health. If you'd like to learn more about Dr. Hall and Dr. Frank, please visit ochsner.org and you can research them on their Found a Doctor. So and we'll also leave the links to their profiles in the comments below. So thank you, everybody.
Thank you,
Thanks,
Yvette.
Yvette.
Y'all have a good afternoon. Thanks.